My name is Dr. Nathan Guerette. The practice is the Female Pelvic Medicine Institute of Virginia. I'm the director of the practice, and I'm a urogynecologist and female pelvic reconstructive surgeon. I was a relatively early adopter of robotic surgery. Before I was in Richmond, I was at the University of Pennsylvania, and we started using robotic surgery for urogynecology reconstruction in 2007. Which was the first year that the FDA actually approved its use. So I've been doing robotics now for longer than anybody in town.
Hi, my name is Kim Kuhlmey. I'm 47 years old. I was diagnosed with bladder prolapse and recently had surgery at Johnston-Willis. It was a robotic surgery. So I was referred to Dr. Guerette at the Pelvic Floor Institute of Virginia, and I had bladder prolapse. There were a couple of tests there that were run, and then Dr. Guerette and I decided that the Da Vinci robotic surgery was the best surgery for me to have. So 5 years ago, I had surgery due to bladder leakage, and I had a urethra sling put in at that time, and my diagnosis was a little difficult due to the fact that that sling was pulling on muscle and causing pain in my lower abdomen. But Dr. Guerette was able to do the robotic surgery, and I had my entire pelvic floor reconstructed.
The main advantage for me in terms of robotic surgery is that the types of surgeries we do are complicated and deep in the pelvis. Robotic surgery really does eliminate many human limitations, so it allows us to have an easier approach to taking care of people, and more successful outcomes, and that's only going to get better.
The robotic surgery was less invasive. I had 5 small incisions, and I healed rather well, considering that I may have had a surgery that required me to have a large incision, particularly because I had to have Dr. Guerette perform an entire pelvic floor reconstruction with the Da Vinci surgery.
What the designation of Center of Excellence means at Johnston-Willis is that you are guaranteed an excellent level of care across the board. So that includes the surgeon, it includes the nurses that take care of you in the operating room, it includes the nurses on the floor and all the support staff that are necessary to have you get a good outcome and a good stay at the hospital.
I would recommend Dr. Guerette to anyone who needed to have this surgery. He knows what he's doing, he takes care of you, he's concerned about your health and well-being, and Johnston-Willis, my hospital stay, was really a great experience.
This is only the beginning. Once you remove the human limitations, you can do an enormous number of things, and I am committed to pushing that. We have been heavily involved in the development of these types of technologies, and we will continue to do so, and the Center of Excellence is a good platform to do that from.